to identify the potential misplacement of the catheter, right? Now I need cellocaine because we want the catheter to be in epidural space. We don't want the catheter to be in either subauricular space or the intravascular space, right? So there are two components of test dose. One, the epinephrine, and you use around 15 micrograms of epinephrine, right? And you record the baseline heart rate of the patient and check for the change in the heart rate by around 20% from the baseline. So there is no change. We started from 136 and after giving test dose, still 133. So that is one. So there is no intravascular placement. Now the second question comes whether I am there in the intrathecal space or the subauricular space. How you are going to check it? In case if you are giving it subarachnoid, if this drug is going to subauricular space, the patient will have immediate effect. While epidural effect, it takes time. Huh? So that is why you have to ask the patient whether the patient is feeling numbness with immediate injection. अभी कैसा लग रहा है कमर में? कुछ आराम है? छाती में जो दर्द है उसमें कुछ आराम लग रहा है? कितना आराम आ गया? 10 में से पहले 10 था, अब कितना है? सांस अभी ठीक हो जाएगा, बट कितना आराम है दर्द में? कितना? 5? अच्छा. So I will just given some another dose, and I will be. Idea is that every dose should act as a test dose because at any point of time. आधा काटने का क्या होना? पूरा एक बारी में कर देना. You have to shots. Where is that dose? जो 3 ml का.
ये वापस पे लगाना. कैनुला ट्रेन
बुटिफिकेन और वो प्रिपेयर करना है.
वो पेंटानिल बुटिफिकेन देंगे. मैं रेडी करता हूँ सर. करना
ठीक है बाबा जी, सीधा हो जाइए. ये हटा दिया.
अनस्टॉल.
सीधा होइए बाबा. अभी छाती में दर्द में आराम लग रहा है?
मैं लेना है 10 ml
एक पिलो दे इनको.
लिया.
पैर सीधा कर. थोड़ा सा ऐसे पिलो देना इनको. यहाँ पे पहले दर्द हो रहा था, उसमें कुछ आराम है? कितना आराम है? मुझे गहरा सांस लेके बताओ. अब सांस लेने में, गहरा सांस खींचने में दर्द है?
आपको सांस लेने में दर्द नहीं है.
दर्द नहीं है ना? क्या नींद आ रही है?
नहीं आ रही.
अरे पिलो, आई नीड 1 पिलो. सर नीचे कर लीजिए. क्या कुछ तकलीफ लग रही है? क्या तकलीफ है? हाँ अभी वो आएगा, अभी आराम है. अभी दवाई और देंगे ना तो आएगा. यहाँ पर पैर मोड़िए, पैर मोड़िए, वो वाला पैर मोड़िए. ठीक है, आ जाएगा. जस्ट अप्लाई द वो ना इस पे हाथ नीचे करिए. अरे यू हैव पिलो और यू डोंट हैव पिलो. ठीक है सर. कैसे है?
पिलो नहीं, यही दे दो. यही
पेशेंट को कितना अनकंफर्टेबल है? अरे ये पड़ा तो है, यहाँ पे किसका है? सर उठाइए. अभी ठीक लग रहा है?
हाँ.
जस्ट पैर सीधा कर लीजिए. You don't have pillow. How इसको कैसे सुबह से मैनेज कर रहे हो? बिना पिलो के?
सर पिल्लो था बट वो उसका कवर में चेंज
नहीं सुबह से कैसे रखा होगा?
उनको पिल्लो
क्या नींद आ रही है? हाँ?
कौन
वो थोड़ा सा इनको प्रॉप अप करो, पेट नीचे कर लो, आई नीचे करके प्रॉप अप करो और इनसे भी स्वाइन मीटर देना।
ये इसी
बस।
यहाँ पे इसी चला
बस,
रहा है
बस 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 नहीं ही वाज ना। आप सांस में दिक्कत है हमें? आप ये बताओ वो जो पहले दर्द महसूस कर रहे थे अजय जी, उसमें आराम है? वो सुई जो चुप रही थी अभी हाथ लगाने से थोड़ा दर्द है? वैसे कितना आराम आ गया? जैसे पहले ये वाला हाथ अपना ऊपर उठाइए, दोनों हाथ को ऊपर कीजिए, दोनों हाथों को ऊपर कीजिए, वो भी हाथ ऊपर करो, छोड़ दो उसको, ऊपर हाथ करो, दोनों दोनों हाथ ऊपर करो, अच्छे से खींच के। दर्द हो तो मुझे बताओ क्योंकि मैं दवाई बढ़ाऊंगा। है कितना नहीं है? पहले 10 में से कितना था? तेज बोलो। अब 10 में से कितना है? कितना? 10 में से 1 2 3 4 0। ठीक है नीचे कर लीजिए। सो ये हैज अ गुड पेन रिलीफ है ना? नहीं पेन रिलीफ इज गुड बट आई एम मोर कंसर्न अबाउट 100 माइक्रोग्राम फेंटेनिल दिया ना, लुक्स इसको फिक्स करना होगा ना। एपिड्यूल किधर फिक्स करोगे? एक ना वो लिपोप्लास्ट जो था ना वो
नैनो प्लस दे दो।
एक छोटा सा माइक्रोपूल या कुछ
ये बताइए नॉर्मल स्लैन देना प्लस काट के दे दो बच्चे।
पता नहीं चलेगा ना, फिर अगर लीक करेगा कहीं से डिस्कनेक्ट होगा ना पता नहीं चलेगा। आई जस्ट वांट कि इट शुड बी पैक्ड प्रॉपर्ली। क्या देखा? अच्छा क्या समझा उसमें?
As a pain relief for the patient, we gave the.
So why we wanted to give a pain relief to the patient?
Because
What do you think, Pulkit?
सर तो और भी जैसे प्रॉब्लम हो, जैसे इसको रेस्पिरेशन मतलब कि ब्रेथलेसनेस वगैरह भी हो रही थी, जैसे ही वो पेन के साथ इनको रिलीफ मिला तो वो ब्रेथलेसनेस वाली प्रॉब्लम भी दूर हो गई और वो अच्छे से रेस्पिरेशन कर रहे हैं और अच्छे से।
So what we have learned that pain is not a great friend. It's not a great friend. In the sense it makes your life difficult. So why this pain has to be taken care of? You can see that the moment the patient is pain free, he looks very comfortable. Huh? So what happens when you have a pain? Nivedita, na? What happens when you have a physical pain? I'm not talking about mental pain. When you have a physical issues, trauma, so what happens with pain?
So, even if we have any type of pain, like main physical pain, if you're focusing on that, our daily day-to-day activity, like even we don't even want to do anything, and everything is disrupted because of that, and so, like.
So that is basically the gross outcome which you're talking about. So when you have a pain,
You don't feel good.
you don't feel good, obviously. But what happens in terms of the biology of our neurotransmitters? So the pain means whenever there is a nociception, there is a pain, it causes release of the inflammatory mediators, it causes overactivation of sympathetic nervous system, you will be having a tachycardia, you may have hypertension, you will be breathing hard, you will be tachyphilic, and this all happens because of sympathetic overdrive. Now remember this thing, if you talk about autonomic nervous system, there has to be balance between sympathetic and parasympathetic. When you have too much of sympathetic overactivity, it becomes a great problem for the patients. Now we need to understand why the sympathetic overactivity is harmful. So Ankur, my question is this, if you are having this patient, where the pain is happening. Why the pain? My question is this: if you are having a patient who has a trauma and the pain is happening, why the pain we see it with a lot of discouragement, and why it is seen as it is not a great thing that the patient is witnessing? In other words, what are the demerits which are attached to the pain in a patient who is there in ICU?
Because pain is only the pain is concerned because pain is only considered as a fifth vital sign.
It's as important as with vital sign.
Yeah. So
Apart from heart rate, saturation, SpO2 and all. So it's a fifth vital sign. So what I'm saying, why you feel pain is important to be addressed in the patients? It's a fifth vital sign, but why it is important?
because it causes too much of discomfort to the patient.
One, you will be in physical discomfort. Okay, that is one part. And what about the neurobiology of the neurotransmitters?
If we consider about the pain scale, if you see the pain scale, if the pain score is very high in ICU per se, it will affect the respiratory physiology of the patient.
Respiratory physiology. So this is important.
Because in case of trauma, in case of post-operative cases, because of the pain per se, patient will not able to properly inspire and expire, which can lead to basal atelectasis, which we generally called in ICU as a post-operative restrictive lung disease leading to. So it may hamper the diaphragmatic movement because if the patient is in the pain, so diaphragmatic movement will not be there.
Very nice. So what happens when you are having too much of pain? You try to limit your pattern of breathing. Your breathing pattern becomes very abnormal. So
Yes.
what Dr. Ankit is saying, let's say that you have a trauma over here, which this gentleman is having. He was having a fractured ribs. If this area is having a lot of pain, would you like to move it or would you like to restrict it? Now this restriction, what will happen? The lungs are supposed to be expanded. If they're not getting expanded, they are getting restricted. What will happen to the lungs over a period of time? They're likely to develop collapse atelectasis, and collapse atelectasis will invite V by Q mismatch. Patient will become hypoxemic. That's why they require oxygen, right? And the lungs will never heal because a collapsed lung cannot heal. In order to invite the healing for the lung, it has to work into its normal physiological state, right? So that is what Dr. Ankit is saying. In this case, the trauma which was there over the topical side, it's going to invite the problems related to your lung functions. Now, this is one part. This is just one part. Now, when you are having a pain is a one thing which affects from head to toe. How does it affect head to toe? As you said, patient will not feel better. Now, when you rate the patient outcome has a multitude of parameters. Infection, morbidity related to the pain is a very important thing which adds to the overall pain. Now, I will explain that what I'm trying to say. The patient may be having a recovery from the kidney, the patient may be recovering from the lungs, patient may be recovering from the heart, but if the patient is having too much of pain, then the only thing on which he will draw his attention is that I'm having a pain. Despite of the fact that the lungs are working good, the heart may be functioning good, the kidney may be functioning good. So their overall satisfaction scores, they're never going to be up to the mark. And psychological well-being effects. This happens at the level of psychology. Now, when it comes to the physical issues, what are the big things can happen? When you have a pain, sympathetic drive overshoots.
Yes.
Pain means release of inflammatory mediators. So sympathetic overdrive, you will be tachycardic, you will be hypertensive, you will be tachyphonic, right? All these things affect your every vital organ function in a very abnormal way, right? What abnormality can happen? Let's say a gentleman who is in this age group, who has coronary artery disease, if he's having too much of pain, what can happen? Because of sympathetic overdrive. Sympathetic overdrive means vasoconstriction, which is likely to happen. So the pain, if it is intense enough, it can even precipitate ACS, acute coronary syndrome, especially with the patients with this age group, right? What happens to your stomach? When you are in pain, can you eat what you feel otherwise in stomach when you are having a lot of pain? You don't want to eat. Why you don't want to eat? Because nociception releases some mediators which invites ileus. It causes ileus, it causes decrease in the bowel activity. So one biggest thing which happens with the pain is that you have more ileus. Ileus means there's no bowel activity. And if you don't have any bowel activity, what will happen? Eventually you will have emesis, you will be having a lot of nausea. Again, it will affect both physically as well as mentally. Now, the biggest thing with the surgeon, they are interested. the surgeons, they are always interested that wherever there is a trauma, it should heal better. If you read in the literature, pain leading to sympathetic overactivity is associated with poor wound healing. Healing doesn't happen. You know why? Because the site which is having a pain has a lot of inflammatory mediators, and inflammation doesn't allow it to heal. Healing happens when there is less inflammation and there's more recovery cells which are recruited over the site. Inflammation invites not only infection but also the inflammation which becomes overactive, and eventually it interferes with your fibroblast and this, the healing which happens by primary and secondary infection. So the wound healing is actually get affected if you are having a lot of pain, right? Not only this, what else can happen? If you have a pregnant patient, uteroplacental insufficiency. So too much of pain, all the blood is diverted over to the vital organs, placenta is not receiving any blood, eventually the placenta get hyperperfused, there's a problems, right? So in short, pain, as Dr. Ankita said, it's as important as fifth vital sign. And fifth vital sign to the extent that it can cure paradise, everything, right? And that is why the pain has to be addressed as a top priority in surgical ICU. Yes. And pain has been seen as an independent factors in deciding about the patient outcome. I don't know why we believe that the pain should not be treated. So in fact, the pain is the one thing which need to be addressed because of all this multitude of factors which we have discussed. So pain is as important as your heart rate, the BP, the saturation, and your lung functions. अजय जी कैसे हैं आप?
ठीक है।
अभी ठीक नहीं है, थोड़ा सा तेज बताएं, मैं रिकॉर्ड कर रहा हूँ। अभी क्या छाती में दर्द अगर समझा जाए तो 10 में से कितना है? 5, 6, 7, 10 कितना है? 10 में से 10? मतलब इतना ज्यादा दर्द है आपको? अच्छा, और चोट कब लगी थी आपको?
चोट लगी थी, परसों लगी थी।
परसों लगी थी, हाँ? अच्छा, दोनों ये हाथ मुंह पे लीजिए, खांसी करके दिखाइए, दोनों हाथ, हाँ करिए, तेज खांसी, खांसी करने में दर्द हो रहा है?
खांसी को नहीं,
दर्द हो रहा है, अच्छा ठीक, कील से चुभती है, ठीक है ठीक है, हाथ नीचे कर लीजिए, हाथ नीचे कीजिए. So you can see that he's having a flail chest. He has gone through the trauma where he had the motorbike which has fell on his chest, and now because of this trauma he is having a hemothorax, for which ICD has been inserted. So now we are going to plan for the pain management for him, and we will reassess his pain scores after the thoracic epidural catheter. एक सुई लगाएंगे, ठीक है, कमर पे, उससे आराम आएगा, ठीक है. हाँ जी अजय जी, अब कैसा लग रहा है इसको लगाने के बाद? सुई लगाने के बाद कमर पे दर्द में कितना आराम है?
अब तो बहुत आराम है.
बहुत कितना? पहले 10 में से 10 था, अब कितना है?
10 में से 10 है.
अब 10 में से कितना आराम है?
10 में से 10 है.
10 आराम है, यानी 0 है. हाँ, क्या नींद आ रही है अभी आपको? आंखें खोलिए पूरी, जीभ दिखाइए. ठीक है, अब ये बॉल वाली एक्सरसाइज करके दिखाओ. कैसे पता चलेगा कि दर्द में आराम है? अच्छे से करो, खींचो, पूरा खींचो, पहले खींच नहीं पा रहे थे. अरे वाह, ये तो बहुत बढ़िया है. दिस इज वेरी गुड यार.
पेन कंट्रोल हो गया ना.
ठीक है, थोड़ा अब हंस के दिखाओ, हंस के दिखाओ, अब तो कम से कम हंस के दिखाओ. ठीक है.